you've been fighting for women to have a nice pregnancy this entire time. Can you talk about some of the work you've been doing?
Oh, well, great. Thanks for the opportunity. Well, since 2015, I started out working in Adams County in Southwest Mississippi to help women, particularly Medicaid beneficiaries who have the worst birth outcomes across the country, particularly in Mississippi, to have a healthy prenatal experience, which usually leads to a healthy birth. And in 2019, we opened our doors in Jackson to continue the work. The work has been funded through grants. First the Humana Foundation, then the Kellogg Foundation. And then because grants don't last, and that's why so many community health programs don't last, regardless of how effective they are, and my program has been very effective in using community health workers to work with women who are pregnant to help them to change lifestyles that we know can lead to poor birth outcomes. So I decided to open a clinic almost a year ago in June so that we could provide clinical care as well as community health and link those two services together, which is a CDC best practice. It has produced outstanding results, having a midwife to provide prenatal care and having community health workers to provide non-medical education, social support, labor delivery, breastfeeding, childbirth education, and so many other things. So yes, and the fight continues. Next up is a freestanding birth center, which will be the first one in the state of Mississippi.
So not only are you trying to get the center together, but you also have a congressman behind you. Can you tell me who that is and how that's going so far?
The one and only Congressman Benny Thompson. It has shown consistent support for this work, and I believe he was delivered by a midwife. I was told by a historian that he was. He understands the importance of giving women access to midwives, and women in Mississippi don't have much access to midwives. His office is considering my proposal for funding, appropriations funding for fiscal year 2023 to build a freestanding birth center in Hinds County, which would definitely be in his congressional district, which needs it most. And we are currently looking at land to buy in Hinds County in a rural environment so that women can travel from around the state of Mississippi to get access, to have access to midwives. And what's most important about this is that the midwives will be able to not only provide prenatal care, but they'll be able to deliver the babies, which is something that's rare in Mississippi. Women who want a midwifery birth would have to travel to Meridian, where there are only 2 hospitals in the state of Mississippi that allow a midwife hospital privileges to deliver a baby, because midwives are woefully discriminated against by hospital administration as well as by doctors who usually make up the hospital administration, the senior administration. And so midwives, for the most part, are working as labor and delivery nurses, not being allowed to fully practice their scope that they've been trained to do. So the birth center is that one place, that healthcare facility that is regulated by the state of Mississippi and by the Centers for Medicare and Medicaid, where a midwife can fully practice and safely practice her art. And natural birth is an art for us. It's not something that we see as a disease. So we're planning to buy land and build, and we will also build a guest house on that property. So for women who are traveling more than 30 minutes outside of the greater Jackson area, they'll have a place to stay. You are aware that women are having babies on the side of the road because they don't have hospitals or doctors in their zip codes. They can't make it to a hospital, and so they end up having a baby at home or on the road in the car. What we're going to do is build a guest house on the same site where the birthing center will be, so a woman can come during the week of her due date, and she can stay there in the guest house until it's time for her to go next door and deliver her baby. So we've thought it out. We know we have maternity deserts around the state. By maternity deserts, I mean places and communities where there are no OBs, obstetricians. We have a shortage, severe shortage of obstetricians, and nurse practitioners are not allowed to fill those gaps because of Mississippi's law that requires nurse practitioners to get a collaborative agreement with a doctor And so that makes it impossible for us to provide, or for them to provide health care in these very underserved areas. And so that's how we're going to do it. And we're moving towards that.
Awesome. So then, I mean, all of these things are being chronicled in a documentary that's coming out.
Well, the documentary, Our Bodies, Our Births, which also happens to be the motto of Sisters in Birth. What I mean by that is we want to put women, and we do put women in the driver's seat of their birthing experience. Women should be making decisions about what kind of birth they want to have, what kind of prenatal experience they want to have. If they want a midwife, they should have access to a midwife. And if they want a doctor, they should have access to a doctor. So this documentary looks at, it examines the struggles that Black women, particularly Black women, have experienced historically here in Mississippi trying to achieve birth equity. And then it moves towards today in terms of birth disparities that have persisted throughout our history, haven't changed, they've only gone down some, but they're still very high. And look at where we are today and how moving forward with this model. What is this model? It is clinical care and community health, midwives and community health workers within a birth center setting. And we intend to replicate this model across the state of Mississippi.